know what time it is. It's Health Talk with Bibi this morning on Voice of the People 90.3 FM. As you all know, every 10:30 on Saturdays like this, we talk about health. We'll take you through different health problems as well as the preventive measures and solutions to them. So this morning, I'll be talking about particular disease that we all know about. In fact, it is not strange to our ears, but the fact is that we might not have adequate knowledge of this particular disease. We might not be well acquainted about this disease. So today I'll be talking about typhoid disease, but I will not be doing this alone. I have a doctor who is connected to us via our phone line, so he'll be talking to us concerning typhoid. His name is Dr. Adeyemi Adewumi. Good morning, Dr. Adeyemi Adewumi.
Oh, good morning, ma. How are you doing?
Fine, thank you. All right, Dr. Adeyemi Adewumi is a young doctor with a penchant for excellence across all endeavors. And while uncompromising his integrity, would engage in solving problems across the several climes he ventures into. He is a very meticulous and qualified medical doctor with the requisite clinical knowledge and skills needed to help patients segue from the disease state to a healthy one and to seek further opportunities to sharpen his clinical skills. Dr. Adeyemi is among the medical team lead of King's Medical Consultancy and also a medical officer in General Hospital Odon. Welcome to the Health Talk with Bibi, Dr. Adeyemi.
Oh, thank you so much. I really appreciate it.
All right. So to our listeners out there, while this conversation is going on, if you do want to ask Dr. Adeyemi any question concerning typhoid, the number to call is 0904 334 9253. I take that again, 0904 334 9253. So I'm going to repeat these phone lines along the conversation. So if you don't get it now, don't worry, you get it later. All right, Dr. Adeyemi, to start with, can you give us an insight to what typhoid is?
Okay, typhoid fever is actually like a part of, there's something called enteric fever. So meaning we have typhoid fever and paratyphoid fever. So basically we'll be talking about typhoid fever, which is a bacterial infection. So I need to explain in layman's language.
Yeah, so
for
everyone
the
can
people
understand.
who outside to understand. So I won't be using too many grammars. So typhoid fever is a bacterial infection that can actually spread throughout the body, and it affects many organs without prompt treatment. It can cause serious complications and can be fatal to the human. And again, it is caused by a bacterium called Salmonella typhi. And this organism is related to the bacteria that actually cause Salmonella food poisoning. And again, one thing you should know about typhoid fever is that it is very highly contagious. And an infected person can actually pass this same bacteria out of their own body, maybe through their poo or pee. And though it is less commonly through the pee, but majorly you can actually pass this bacteria through the poo. And if someone else eats food or drinks water that is being contaminated with small amounts of infected poo or pee, it can become infected with the bacteria and develop typhoid fever. And basically, we need to understand who are the category of people that are majorly affected. Typhoid fever is most common in part of the world that have poor sanitation and limited access to clean water worldwide. Children are thought to also be most at risk of developing typhoid fever, and this may be because of their immune system. And what do I mean by immune system in a layman's language? Meaning the body natural defense against infection and illness, meaning that they are still developing. So, but children with typhoid fever tend to have milder symptoms than adults. So basically, that's the introduction about typhoid fever.
All right.
And again, the epidemiology, we need to understand that the incidence rate, it is estimated that 13 to 17 million cases worldwide, and we've actually accounted over 600,000 deaths per year. And like I said earlier, the incidence is highest in children aged less than 5 years, and it is more common in endemic areas, endemic regions in most developing regions, such as India, Africa, of course, and South and Central America.
All right, thank you, Dr. Adeyemi. Let's talk about the risk factors for typhoid.
Okay, for the risk factors for typhoid fever, like I said, one of the major risk factors for typhoid fever is contaminated water supply. Meaning that if you are the type that consume water that is contaminated by feces, there's a high chance that you can actually come down with typhoid fever. And apart from that, there's something called fecal-oral transmission, and this one describes like a route of transmission of a disease whereby the pathogens, meaning the fecal particles, can actually pass from one person to the mouth of another person. And the main causes of fecal disease transmission include what? Lack of adequate sanitation. So, meaning if you want to actually eradicate or curb these acts of typhoid fever, meaning we have to have a proper what? Hygiene. And that is not the only risk factor that can actually predispose the patient to develop typhoid fever. Even if you eat food from street vendors, you can actually come down with typhoid fever because if they are contaminated. Also, raw fruits and vegetables, meaning that you need to wash your fruit and vegetable properly. But the main thing I would want to tell the population here is hand washing. You need to cultivate the habit of hand washing, proper hand washing without, not the one you wash without soap. You need to cultivate the habit of washing your hand with soap. So those are actually the major risk factors. And again, if you actually have contact with patients that is affected with what? Typhoid fever, yes, there's a high risk that you can actually get it through that. So those are the major risk factors.
Okay, Dr. Adeyemi, can we talk about the symptoms? Because it seems it shares symptoms with malaria.
No. The symptoms of typhoid fever is different from malaria. But we want to know is,
but most times you hear people say, I don't treat malaria without treating typhoid. You hear them say headache. It seems this headache is typhoid headache.
No, there's nothing like typhoid headache or malaria headache. So the thing is that the cause of typhoid, like I said, is a bacterial cause. Why for malaria is not the cause of malaria is not through the bacteria. There's something called plasmodium.
Okay.
Do you understand what I'm saying? That's another family entirely. It's just like you saying that okay, yeah, Yoruba, okay, you are an Igbo. Do you understand? So typhoid is from
malaria.
God bless you. Yes. So now one of the symptoms of typhoid fever is persistent high temperature. Though it can gradually increase each day. So, but when you see a patient coming down with persistent high temperature, headache, general body pains, and extreme tiredness, constipations, and diarrhea, or it could never be constipation, it could be diarrhea. So, but you can't just conclude that this patient has typhoid fever, but you can just suspect that okay, this could be a case of typhoid fever. There are other things we actually look out for, because for a good doctor, you don't just look at just the history. There are other things you need to carry out investigations and examinations for you to now come down to a conclusion that okay, this patient is having typhoid fever. Like one thing I want people to know is that majority of people feel typhoid is just like cough or like malaria that you can just come down with. When you see patient with typhoid fever, you won't pray to have typhoid fever. It is a serious illness. You understand? It is a very serious illness because if it is not treated on time, it can actually come down with big complications, because as the infection progresses, you may lose your appetite and feel sick more, and in fact you may start having abdominal pain, diarrhea. Some people may even develop a rash. So when it comes to a rash, there are other terms you can use as a doctor, but I don't need to explain this to the population. I just want them to know that typhoid fever is not something you just call out like that, because if it is not treated, the symptoms will continue to get worse, and if it progresses after like several weeks, you can develop complications from it.
All right, doctor. But usually you see people saying, I have typhoid.
Okay.
They'll just go and get drugs from these over-the-counter drugs.
Yes.
Does it mean, because you're saying that typhoid is very serious, that if we see people suffering from typhoid, we won't pray to have it? So does it mean people saying they have typhoid, they don't really have typhoid?
They don't really have typhoid, because when we talk about how typhoid is treated and the diagnosis, the gold standard for diagnosing typhoid fever is blood culture. So blood culture will actually pick the Salmonella typhi. Do you understand? So that's the only time you can confirm that okay, this patient has typhoid fever, and there are antibiotics recommended for management of typhoid fever, which I cannot be listing that. But when you are being diagnosed of typhoid fever, obviously in a good hospital, in a good setting, so they'll place you on the regimen and you'll be fine. You'll come out well. Do you understand what I'm saying?
Yes.
Okay.
All right. Sometimes also we'll hear people say typhoid affected my brain, it affected my intestine. So my question is, can typhoid affect the brain? Can it also affect the intestines?
Sure. The typhoid can actually affect the brain, and it can actually affect the intestine. So there's something called, like I said typhoid fever. The major cause is Salmonella typhi, which is a bacteria. By the time you have a lot of bacterial load in your bloodstream, there's a term we use which is known as bacteremia. So that bacteria can actually spread through the bloodstream and gets to the brain. When it gets to the brain, they can actually attack the major organ. Do you understand what I'm saying?
Yes.
So, and when they get to the intestine, they can also do the same thing. And okay, let us put it this way: for the gastrointestinal complications now, when they get to the intestine, they can actually cause intestinal perforation. Do you understand? And when you develop intestinal perforation, the only way we can know as a doctor is if the patient can present as and develop abdominal swelling. Do you get what I'm saying?
Of
So that's
course.
one of the complications for the GI. But for the brain, when it gets to the brain, you can develop brain abscess, and the patient can even present with seizure. Meanwhile, you won't know, but this is a complication. Do you understand what I'm saying?
Yes.
There are also other form of complications. We have respiratory complications. The patient can come down with pneumonia. Do you get? We even have hematological complications. The patient can present with anemia, DIC.
All right, doctor. Sorry, we have a call. Let's take this one.
Okay.
Hello, good morning. Hello.
Good morning.
Beautiful morning to you. What's your name and location?
This is MNK calling from Ikeja.
All right, Emenike, you're welcome to the health show.
Thank you.
Yeah.
So when you develop hepatitis, because the liver has so many functions, so the patient may present with jaundice. So you'll be wondering now what is the cause of this jaundice. That is why one of the most important things as a doctor is your history must be very detailed. You can't just jump into the conclusion and start treating typhoid fever. You must rule out other causes and be sure that okay, this is what we are dealing with. And people too should make sure that they don't do self-medications, because I see most people when they have symptoms, it's not with typhoid, they'll start abusing medications. And when you do that, you develop resistance. By the time you now have serious illness, when you now do that's when you now develop that okay, most of the antibiotics that they are meant to use to treat you, you're already resistant to it. Do you get what I'm saying?
Yeah.
And so you shouldn't be in a hurry to use medications when you are sick. You have to confirm what is really wrong with me. You have to go for medical checkup, do your full-blown test. Though I know that it is not easy because of the cost, but it is very important that you need to do these things before you start using antibiotics, especially Flagyl and ciprofloxacin. Most people abuse those medications. Any small thing, headache. Imagine someone using Flagyl for headache. It is unfair. You're being unfair to yourself. So we should learn to also look out for ourselves and go to the hospital and let us know what is really going on with us before consuming any form of medication. So those are one of the ways.
All right, thank you, Doc. If you want to contribute, if you have questions to ask Dr. Adeyemi, do call us on 0904 334 9253. 0904 334 9253. All right, while waiting for your calls, Dr. Adeyemi, I want to ask this question. Is it contagious by sharing utensils such as cups? Because I remember a doctor telling a friend who has ulcer not to share things like cup with her family in order not to pass the bacteria to others. So is that also applicable to typhoid?
For typhoid, like I said, the major route of transmission is fecal-oral, and I explained the meaning of fecal-oral to you. Maybe I should come back again.
Yes,
meaning that
all right, when you have a call. Sorry, let's take this call. Hello, good morning.
Hello, good morning.
Good morning, go ahead.
Is this Voice of the People?
Yes.
All right, I'm listening to your live show and I have a question for the doctor.
Go ahead.
Okay, so I wanted to, can you hear me?
Go ahead, I can hear you.
Okay, so I wanted to ask that what are the common complications like the most common complication that someone that has typhoid would show, or what are the signs of typhoid? Because I know people say, oh, okay, some doctors I've heard them say that there's nothing like typhoid, that typhoid does not exist, and all. But then I've also heard some people say, it's amenable to surgery. So how will I know, or how will somebody know which one?
All right, thank you very much. Dr. Adeyemi, did you hear what she said?
Yes. She said what are the common complications of typhoid fever?
As well as the symptoms.
And as well as the symptoms. Well, for the symptoms, I said it earlier that one of the earliest symptoms you can actually have is persistent high temperature. And it can actually associate with headache and extreme weakness, tiredness, diarrhea. But the most common complication basically for typhoid fever.
Dr. Adeyemi.
Yes.
Please, someone is on a call. Let's take that so you can answer the questions at the same time.
Okay. Fantastic.
Hello, good morning.
Hello, good morning. This is Adewale on the line.
All right, Adewale, go ahead. Go ahead, we can hear you. All right, Dr. Adeyemi, go ahead. The callers and
Okay, like I said, I mean, for the complication, basically it's more of GI complication. The patient can present with internal bleeding or perforation. So those are the two major complications of typhoid fever.
okay.
Yes, you can develop perforation, and when you have a perforation of the intestines, you can present with abdominal swelling. I mean, the patient tummy will be very big, and it can actually, like I said, you can, if you have bacteremia, it can spread to the brain, and you can develop, brain abscess. But that's not like that's like a long term complication, not a sudden one. But the one that can actually come faster is the GI internal bleeding.
All
And
right.
when you have internal bleeding, the patient may present with, when the patient will be telling you that whenever I pass feces, I'm always seeing blood in my stool. Do you get what I'm saying?
Of
So
course.
these are the things, yes. Those are the things to watch out for.
Okay.
Yes.
So I asked a question before the call came in. I was
Okay.
asking sharing cups because of the bacteria and all of that.
Well, let me put it this way. You can actually share cup and spoon, but the thing is, for you to get typhoid, that means the cup or spoon must be infected with fecal matter. Do you understand?
Okay.
Meaning there's no proper washing. Meaning that's why, like I said, one of the way we talk about the prevention, you must
All
be.
right. Sorry, Dr. Adeyemi, we have a call. Sorry.
Okay.
Hello, good morning. Hello.
Hello, good morning.
Good morning. What's your name and location?
This is John from Sulure.
All right, John, go ahead. Dr. Adeyemi can hear you.
Good morning, doctor. Please, I want to find out if it is advisable for one to take all this abo after treating typhoid, because I treated typhoid like last week, and some people told me that I should go and take abo to flush everything out. Even I started the pharmacist close to my house, and he said yes, that I should go and look for a good abo and take so that I can flush everything out. Please, what do you advise on this? Thank you.
All right, thank you very much.
Okay.
Doctor, did you hear him?
I think he was talking about using herbal concussion, right?
Yes.
For treatment of typhoid.
Yes.
So I'm happy he brought up this question, because in our practice here, we've come to realize that most people come down with what we call CKD, like chronic kidney disease. Do you understand?
Okay.
And one of the risk factors for CKD is consumption of herbal concussion. One thing you should know is when you are being given medications in the hospital, they give you based on dosage, but you cannot actually quantify that for herbal concussion. You only take it as much as you can tolerate, and those things contain things that can actually knock off the kidney. So when you tell me you are using herbal concussion to cure typhoid fever, that is not something that is possible. You are only causing more harm than good, because what will come down, you may not even come down with
Sorry, Dr.
comorbidity.
Adeyemi. Let's take this call. Probably our
Okay.
last call for today.
Fantastic, no
Hello,
problem.
good morning.
Hello, good morning.
Beautiful morning to you. What's your name and location?
Koya Babafemi, calling from Ikeja.
All right, go ahead. Dr. Adeyemi can hear you.
Oh, okay. Good morning, Dr. Adeyemi.
Oh, good morning.
Thank you very much for that wonderful presentation. I must commend you. I have no doubt that the public has benefited from the wealth of knowledge of one of the best doctors in the country.
Thank you so much.
My question to say goes like this, to say that I want you to debunk this myth on the use of wider tests. You have a lot of people tell you they have typhoid because they have elevated titer values and all. What's your take on that, sir?
Okay, one thing to know is that for wider test is not actually the gold standard for diagnosing typhoid fever. The gold standard for diagnosing typhoid fever is blood culture. I know that blood culture is actually the primary diagnostic test, and it is actually positive in 90% of patients during the first week, and also remains positive for several weeks thereafter if the patient is left untreated. But for blood for wider, there's something called wider agglutination test. This measures the agglutinating antibodies against H and O antigens of the Salmonella typhi. And the thing is, the titer of agglutinins against, you may not really understand what I'm saying, but in summary, just know that a 4-fold rise is said to be suggestive of infection, which is basically for sensitivity for wider test. And the thing is, why wider test is not actually encourages that there is high rate of false positivity and false negativity. But for it to confirm typhoid fever, the gold standard for it is what? Blood culture in a good lab. Do you understand? That will confirm the diagnosis, and then they will commence what? Adequate treatment for the patient, which will actually reduce what? Mortality and morbidity.
All right, Dr. Adeyemi, I think our time is ticking very fast.
Okay.
We have a whole lot to talk about concerning typhoid. Probably we'll do this same time next week.
No problem.
Because calls are still coming in. People want to ask questions, so we might do this next week. So, Dr. Adeyemi, please, your last words, probably preventive measures, what people should do.
Yes. Okay, now the prevention and control, the strategies is first thing, and the people should know is personal hygiene, which is very important. Adequate hand washing. We need to wash our hand adequately, and good food handling practices too, very important. And also water treatment. So you don't just consume any form of water. You need to what? Boil your water. So, and sanitary waste too. The way you dispose your faces too is very important. And again, for typhoid fever, there's something called mass immunization with typhoid vaccines. However, for this vaccination, it is actually recommended for anyone planning to travel to part of the world where typhoid fever is actually widely spread, meaning where typhoid fever is endemic. There are different kind of vaccines for typhoid fever. Basically, we have two vaccines which are available. Do you understand? They can provide some protection against typhoid fever. And the areas with the highest rate of typhoid fever, when you are going to those places, you can be advised to take those vaccines. So, but majorly, the major prevention, because the mode of transmission is fecal. So, the major prevention of what typhoid fever is what? Personal hygiene.
All right.
Very, very important. Yes.
All right. Thank you, Dr. Adeyemi. Thank you so much for joining us. But we'll have a whole lot concerning typhoid that we did not talk about today. So probably next week we'll continue this conversation. So if you're listening to us and you've been calling, we're not picking, do well to join us same time next week so you can ask your questions. But if you missed this program, do well to watch us on YouTube via our YouTube channel, Voice of the People 90.3 FM. All right. Thank you so much, Dr. Adeyemi. See you later. Thank you for joining us. All right. So that's how we'll come to the end of the Health Talk with BB this morning. But that's not the end of all the programs we have on Voice of the People 90.3 FM. Up next is Business Roundtable with Peter and Nosiki.